the healing took me about 5 months to start feeling like myself again. After my excision surgery, it took me 2 weeks to actually start to be able to walk downstairs with my dad holding me holding on to the railing and having a cane.
Want a break?
Yeah. But yeah, it was just a lot longer of a process than I had anticipated, especially kind of comparing it to that first surgery. So I'm Emma. I'm 25 years old. I am based in Portland, Oregon right now, but I grew up in New England area for pretty much my whole life. I've been in Portland for about 3 years and I love it here. I am an endometriosis advocate who spends a lot of time raising awareness and sharing my story with endometriosis and other conditions that I live with, like adenomyosis, PCOS, Ehlers-Danlos syndrome, MCAS. Got a whole list of things that I think is very important to talk about, just because it took me 7 years to get an endometriosis diagnosis. So growing up, I always had issues, but I always had a lot of joint pain and a lot of pain throughout my body. And again, it was kind of normalized. And at the age of 13, I got my first period, and that was extremely heavy and painful. Nothing was helping. Fast forward to 2019, September of 2019, my health was just not in a great spot, and my periods were getting debilitating, and I went to an OBGYN and I talked to him about my symptoms, and he said, I think you have endometriosis. And I kind of laughed at him and I was like, no, I brought that up to my doctors before. I don't have it. Because my doctors told me that I was too young to have endometriosis. Because I did my own research, and I did, Google brought me to that very early in my journey. But then I brought it up to my doctors and they said, no, there's no way. And also it could not be affecting you in the ways that you're saying that it is. So I kind of was like, okay, write it off. That's not what I have. So I stopped going down that route. And my OBGYN was like, well, did you have a surgery? I was like, no. So he scheduled me for a surgery 2 weeks out. And then I had a diagnostic laparoscopy where he used ablation, which I didn't know the importance of ablation and excision, that you want to find an endometriosis excision specialist to perform your surgeries. But I got my diagnosis and I was very grateful. And then I just had another surgery for endometriosis with an endometriosis excision specialist in January of 2023. The diagnosis was one of the most validating things that I've ever had. I cried. I woke up from my surgery and I was like, did I have it? From both of my surgeries, because I was convinced with both surgeries that they were going to find nothing, just because nothing was showing up on scans or x-rays, CT scans, nothing was showing up for them. So both surgeries, I woke up and I asked, did I have it? And they both said yes, and a lot. And then with my second surgery, they found so much more because I was with an endometriosis excision specialist. But so the difference between my first and second surgery is drastic. My first surgery was booked within 2 weeks. It was the OBGYN who told me that he thought that I had endo. And like I said earlier, I didn't understand the importance of finding an endometriosis excision specialist. So again, I'm very grateful that I got my diagnosis, because it gave me answers and I really started to understand my body and rebuild that relationship, because I became so disconnected with my body because I convinced myself that I was crazy and thought that my body was just fighting against me and was my enemy, which I now realize that it's doing everything it possibly can to keep me alive. But through that surgery, it was under 2 hours. He used ablation, which is burning the endometriosis, and only looked in my lower pelvic region. So I have one scar, right above my pubic bone. I have one to the left and then one through my belly button. And he found what was obvious endo. Endo can show up in so many different ways. There's a multitude of, like, there can be angiogenesis, which is new veins, or maybe not new veins, but endo's creating abnormal blood vessels. It's blood vessels. And endo can show up as blue or black or brown or clear reflections. And I think that he saw some of it, which was great. But it actually ended up leaving me with a lot more pain after the surgery and a lot more adhesions because, again, he burned it. And by burning the disease, you're not getting to the root of it. The root of it's still in my body. And you just burnt it, and then it creates this sticky scar tissue that's going to make other things stick in the region that's already so inflamed and so in so much pain. So after that surgery, I felt okay for a little bit. I felt better for a little bit, but then things just started to really progress again. So I started to seek help from an endometriosis excision specialist. After that first surgery, I really submersed myself in the community. Like I said, I wanted to share what I was going through so that the people in my life could better understand and better support me. Because it was hard for people to understand how dynamic it can be and how I can do one thing one moment and then the next I'm in debilitating pain, and which is understandable because I'm constantly confused and it's my body and I'm living it. But through the endo community, I learned that it's so important to find an endometriosis excision specialist. It took me 2 years to actually get a surgery date. And I remember my first appointment with him. He sat me down and was like, your textbook endometriosis. Him and his colleague drew me pictures and talked about the misinformation and wrote like everything down so I would have a better understanding of what's real, what's not real, like common misconceptions out there, drawing me diagrams, like talking to me like I'm a human who's going through something and not just a number. But my excision surgery, the healing took me about 5 months to start feeling like myself again. And it took me 8 months to start walking upstairs normally. Through my excision surgery, they found endo on my colon and my ribs. I had Allen Masters windows with deep infiltrating endo going through the sidewalls of my stomach. They excised entire sidewalls. They went into the muscle layer of my bladder. I had endo on my uterus. I had endo in my rectum, in my anterior and posterior cul-de-sac. A lot of these are medical terms that I'm still trying to understand. But I just had so much endo everywhere, and they excised it. And like I said, they went and excised entire sections of my body. So it just took a lot longer to heal than I was expecting. I ended up traveling from Oregon to go stay with my parents and ended up staying with them for 5 months. I thought that I was going to be out there for, actually, I think it was 4 months. It was about 4 months that I stayed at my parents, and they helped me with so much. I wasn't able to shower myself, which was something that I didn't really struggle with as much after my first surgery. My first surgery, I felt like I went back to college after 2 weeks because that was all my doctor could give me. It was like, you'll be fine in 2 weeks. Like, just go. You can proceed with your normal activities. And I was like, okay, well, that's what the doctor says. And I was feeling a little bit better, but after my excision surgery, it took me 2 weeks to actually start to be able to walk downstairs, with my dad holding me holding on to the railing and having a cane. Um, so it was just a longer process, more medications, more support. Um, my mom, we got like a shower chair because I couldn't hold myself up on the toilet either, because it was too low. So they ended up getting something with handles so that I could support myself, because there were times where the pain would be so intense that I thought that I was going to pass out, and I just like didn't feel safe, I guess. And then we used that same chair and put it in the shower. So I would get in a bathing suit, and then my mom would wash my hair for like the first few weeks, which I'm very grateful for. Um, but yeah, it was just a lot longer of a process than I had anticipated, especially kind of comparing it to that first surgery. But the two surgeries don't really compare. Um, yeah. And then my first few periods after my excision surgery were some of the most painful periods that I ever had, because everything was just still healing and so raw. And again, they had to like dig into so much and get to the root of so much that I kind of thought, I knew that my periods were going to be painful, but I just didn't think that they were going to be like that. Um, but that kind of relieved itself as the months went on. Just the first two periods that I had, I remember, were scary. I was not anticipating how long my healing process was going to be. I think that we were kind of expecting it's going to be more than 2 weeks. Like, it's probably going to be more like 4, and then you'll start to feel better. And I was feeling a little bit better. Like, I started to be able to get out of the house. My dad would take me for 5-minute drives so that I could just get out of the house and get fresh air, and then step out with my cane and then hop back in. And I was feeling a little bit better, but I just wasn't back to myself for 4 to 5 months, which I was not expecting. Neither were they, but they were there to support me through the way. And we definitely had some appointments where I was like, I don't know what to do. Is there anything that I could be doing? And they were like, the only other thing is hormones, like to kind of see if it can suppress things. And I was like, I'm just not willing to do that again. So they definitely prepared me for my period being more painful, especially through the endo community. I did learn a lot about that. I just didn't know how intense it was going to be. Like, because they excised from my ribs, like that felt like it was burning and on fire. And I remember being in bed and my body would just go into full twitches because I think it just didn't know how to handle the pain. And then I would twitch so much, like kind of the feeling of when you're sleeping and then you feel like you're falling, if you've ever had that. Um, and I would like catch myself and jump up, but then because everything was still healing, it felt like things were like ripping. Like, I just, they definitely told me. I just didn't really, it didn't resonate how much it was going to be, for my periods and just the healing process in general.
I'm giving myself a sponge bath because I haven't been able to get out of bed.
I did not use all of my pain medication from my surgery, like Oxy. It was one of the Oxy something, which was an opioid, and I realized that my body was starting to get used to it, which scared me because I know that the opioid epidemic is a very, very real thing. And I started to understand that more when I was taking them. So I stopped taking them and was just like, I'd rather kind of muscle through the pain than have another thing. So they gave me higher doses of ibuprofen. I would take ibuprofen every 6 hours, or I think it was every 6 hours, but then I would switch between ibuprofen and Tylenol every 3 hours. So it would be 6 hours in between. Um, and then a lot of like outside pain management, like heating pads, and some days cramp cream was something that really helped me, and CBD. And I have like this whole toolkit of things that were really helpful, but medications, I'm still struggling to get something that actually is helpful. Because they're like, well, just like you can take ibuprofen, and my surgeon's amazing, but they put me on muscle relaxers as well. But I've since learned that I should not really be on muscle relaxers because of my Ehlers-Danlos syndrome, because it's a connective tissue disorder and can make things worse on that front. So I think I'm still navigating that. Um, but it didn't really feel like I got much support on the pain medication side of things, which was a bummer because it was a lot. And I ended up on my periods going back and taking the oxy that I had left over because I was in that much pain that I was like, okay, well, something's got to give. Like, at least I'm aware of when I take it for longer amounts of time that it starts to wear off. But like, be aware of that and be conscious of that and don't let that kind of slip. So I took that very hesitantly with my periods. So that was something that helped, but that wasn't something that was like, oh, let's give you more of something that would help you. It can be really hard to describe the pain. I think that I'm starting to understand it more, especially through other people explaining their pain. I'm like, oh my God, yes. Like sometimes it's just hard to put words to the pain that I feel like is just there all the time. And then I realized, oh yeah, like some people wake up and they're not in pain. What a revelation. I just sometimes forget that. So it's definitely heightened around my periods, but it's something that I struggle with every single day. And the pain is just so much, and it's invisible, and it's so dynamic. And I just think that there's so much misinformation out there, and also people that don't live with it. You don't get it until you get it, which is why I think it's so important for people to share their stories and share their experiences, even though it can be so uncomfortable and you can be met with so many people that invalidate you or tell you that you're just doing it for attention. But a lot of my doctors don't know what is going on because they run a lot of basic tests and kind of tell me that it's normal, which is what they told me about endometriosis for so long, that it was normal. Everything was coming back normal. I had a low tolerance for pain, and that I was over dramatic, and that periods are supposed to be painful. And even outside of your period, if you're in pain, like, stop talking about it because everything's coming back normal. So now I will never stop talking about it. And that's kind of what I do right now, is just hopefully create a safe space for people to talk about the things that are taboo or just aren't really talked about enough, but they need to be talked about.